This session is about the evaluation of injuries. We will see each injury in detail at a later stage, and we will go into how we are going to evaluate these injuries in order to determine whether they are ante-mortem injuries, post-mortem injuries, the types of injuries to determine what type of weapon or object was used for the creation of those injuries. Before that, we will go into finding out what is an injury. An injury, according to the Indian Penal Code, is any harm illegally caused to any person, body, mind, reputation, or property. The nature and shape of the weapon can be obtained by analyzing the characteristics of an injury, the amount of energy in the weapon or instrument, whether inflicted on a moving or fixed body, the nature of the tissues involved, and the area over which the force attacks. Abrasions, the first type of injury that we are going to discuss, is basically the type of injury that involves the superficial layer of the skin, that is the epidermis or the mucous membrane, that is going to tear from the underlying tissues. This is due to the impact against some hard, blunt, or rough object or weapon. Abrasions do not ordinarily bleed. For example, when you scrape or scratch yourself, there is no bleeding, but there is some amount of skin that comes out from the body. That is known as an abrasion. So, on a normal circumstance, abrasions generally do not bleed, but there can be abrasions that can lead to bleeding. So, abrasions may penetrate through the full thickness of the skin. So, depending upon the amount of force that one person uses to scratch himself or herself, the amount of penetration that is there is directly proportional to the depth of the abrasion that is caused. So large areas of abrasion may bleed. So we have different types of abrasion. The first one is a scratch or a linear abrasion. So this is an horizontal or tangential friction by the pointed end of some object like a thorn, nail, needle, or a tip of any weapon. So a pointed object that is scratching against the body linearly is known as a scratch or a linear abrasion. Then we have grazes, which are also known as sliding abrasions, tangential abrasions, and also brush abrasions, caused due to the horizontal or tangential friction between the broader area of the skin and the object or weapon or hard surface of the ground. In a road traffic accident, if a person falls on the road and if he is moving, right, so his body, some part of the body may scratch against the road. Those scratches that are resulting on the body are basically what we technically are going to call as abrasions. The epidermis will get heaped up at the opposite side, showing from where the the direction of the movement of the object also can be obtained. So this way, as we see the abrasions, these grazes are mainly found in the traffic accidents. Pressure abrasions, also known as crushing abrasions or imprint abrasions. The impact of these abrasions is vertical to the skin. In this particular abrasion, the epidermis gets crushed and the abrasions are of pressure type result. The imprint of the impacting object may also be produced in case of a rope that is very forcefully tied against a particular arm, neck, or whatever. It's going to cause some abrasion, and the imprint of that rope may be there. We have the example of manual strangulation or hanging. Next is patterned abrasion. Patterned abrasions is a force that is applied at or around right angle to the surface of the skin. A body falling from the top to the ground, like a pedestrian pathway where it is having interlocking tiles. So the impact that the body is going to have on the surface, there we see the pattern of the surface coming onto the body in the form of an abrasion known as patterned abrasions. Atypical abrasions are those abrasions which are short, straight, or curved marks that vary depending upon the circumstance. And there is no particular pattern as such, but they are known as abrasions because they fulfill the criteria of the superficial layer of the skin being discontinued. Going to the age of an abrasion. So we see that we will be able to determine the age of the wound. Here specifically, we are determining the age of the abrasion. We can determine a fresh abrasion. It will be reddish color. There may be oozing out of serum or blood. Then 12 to 24 hours, if you see the wound, we see that there is a reddish scab that is forming. Okay. In 2 to 3 days, the scab becomes reddish brown. After 4 to 5 days, it becomes dark brown. After 5 to 7 days, it becomes brownish black, and then it starts to fall off. So if we have got any kind of abrasions on our hand, we've fallen down on the ground while playing or whatever, we find sometimes a wound, the scab that is there, and we try to peel it off, right? So that is probably between 5 to 7 days, and 7 to 10 days, it automatically should come off. Okay, even if we are not intervening into that. So we see that there is the concept of antemortem and post-mortem abrasions. Antemortem are those abrasions that are formed before the person dies, and post-mortem after the person dies. So antemortem, we know that shouldn't be a problem because we'll be able to see all of these various aspects that are there because the body is living and there is a blood flow that is there in the body. But post-mortem, that is after a person dies, we see that there is no circulation of blood. So that means there is no exudation of the serum, and therefore the surface gets dried up and becomes hard, acquiring the consistency of parchment and also appears brownish. So you normally will not see an abrasion how we would normally see it if it is a antemortem abrasion. Okay, so with this, I end this particular small session on abrasion, one type of the injury.